my vision of what the arc of the moral universe would look like at the point at which it begins to bend towards justice. And I'm going to suggest to you that we in this community and in this country have begun to bend towards justice over the last 5 or 6 years. We are at a critical point in time in the history of the country and the history of criminal justice. It remains to be seen whether the arc keeps bending towards justice or not. And part of what we're trying to do in this community, and tonight's conversation is part of that, is to continue that arc bending in the right direction. This is the number of people in the United States who were in prison from 1925 until the mid-1970s. If you can't see the graphic very well, you can at least see it's almost a straight line. From 1925 to 1975, we had about the same number of people in prison. Over that entire period of time, despite all of the remarkable things that happened in this nation, we maintained a steady state in terms of the amount of punishment we meted out. Now, that was not necessarily something to be proud of, because in the late 1960s and early 1970s, many of us who were around at that time thought we had way too many people in prison. And we thought we knew a lot about what incarceration did to people psychologically. We knew something in the 1960s and 70s that perhaps we didn't know in 1925. And so that number was not necessarily something to be proud of, that instead of being a steady state or a steady number, we should be decreasing it, and we set about trying to do that. In the early 1970s, if you'll pardon me for saying so, all hell broke loose. The nation began to demonize people who had violated the law. The media and politicians contributed minorly to this process. We began to describe people rather than as lawbreakers, but as evil or as monsters. We began to commit ourselves to a lock-em-up mentality. In this state, as well as throughout the rest of the United States, there was a commitment to doing something, and this may sound familiar to you: cut taxes and build prisons. We had a state political system that was devoted to that. We had a governor who was very much involved in a lock 'em up and throw away the key policy. An explosion in crime we kept hearing about in the 1980s and 1990s, even though the facts did not bear it out. We committed ourselves, we committed resources, we committed our policies to programs as if those things were true. And the incarceration rate, which had been steady state for a 50-year period of time, went off the charts. We did that for political reasons largely. We didn't do it because we suddenly discovered in 1975 that incarceration worked. We didn't. It didn't then, it doesn't now. African Americans were especially affected. That's the rate up here. That's the rate of incarceration of African Americans, the rate of incarceration of Latinos, the rate of incarceration of Anglos. You can see that all groups were affected by the explosion in incarceration, but people of color most affected by it. In addition, we began to pack our prisons and jails with the mentally ill. We emptied out our state mental hospitals. And as we emptied them out, the prison system began to fill with people who were mentally ill who otherwise would have been in state mental hospitals. As I stand before you today, there are now 10 times as many mentally ill people in prisons and jails as there are in state mental hospitals around the country. 10 times as many. In California and elsewhere, prison construction was booming. Between 1990 and 1994, we built 10 new prisons in the state of California, but we still could not keep pace. We began to get to the point in the 2000s where the amount of funds that we devoted to prisons exceeded that devoted to higher education in our state. If there is ever an index of dysfunctionality of state government, that might be it. When you spend more on incarceration than you do on education. Beginning around 2000, the state of California, the prison system in California, held twice as many people as it was designed to hold. This did not happen because we were forced to do so, because the crime rate in California, as you may have heard, was out of control during that period, and after all, what else could we do? The crime rate was relatively stable, as was the incarceration rate until the late 1970s. And then the incarceration rate increased. It was not driven, it was chosen, and it had relatively little effect on the crime rate. which remained relatively stable over this entire period of time. People going into prison in the 1970s encountered a prison cell that looked something like this, but quickly thereafter, in the late 70s and early 80s, they encountered cells that had 2 people in them, or 4, or housing units that didn't have cells at all. And this is what prison units, gymnasiums in the California Department of Corrections began to look like in the late 1990s and early 2000s. These were extraordinarily dangerous places for people to live. So this is the rate of inmate assaults over that same period of time. So not only were they unhealthy, medically and psychologically unhealthy, but they were dangerous places for people to live. And in 2011, it became clear that the center could not hold. At that point, the arc of justice began to bend. And oddly enough, it was the United States Supreme Court that seemed to have provided us with the first big pull. In a case that came out of California, Brown versus Plata, the conservative United States Supreme Court said essentially enough is enough. You have gone too far. You have too many people in prison, and you are subjecting them to unconstitutional conditions of confinement. So the court said essentially that in the name of protecting the health and psychological well-being and the dignity of prisoners in California, that the state had to reduce the total population by around 30,000 prisoners. Prison populations at last finally began to decline, not only because California was reducing its prison numbers of prisoners, but other states were doing the same thing. In 2014, a scientific committee of the National Academy of Sciences issued a report on the effect of the high rates of incarceration in the United States. And on scientific, not on political grounds, it reached the conclusion, first of all, that incarceration, the increase in incarceration that had taken place over the previous 30 years was not what was responsible for the drop in crime. There was essentially no relationship between the two. And secondly, the National Academy of Sciences, again for scientific, not for political reasons, recommended that there be significant decreases in the amount of incarceration in the United States because of its psychological and social and community costs. The New York Times finally reported at the end of the year 2016 that the year before was the first year in which there was a significant drop in the overall number of people in prison. Now, there are still other issues, however, that we need to confront. And just yesterday, the San Francisco Chronicle reported that there are problems that still plague the California Department of Corrections. That after all of those years of litigation and after all of those prisoner releases and the reforms that have been made in the delivery of medical and mental health care, that prisoners in California are still faced with serious problems and substandard care, and that there are still 1/3 of the prisoner population that is mentally ill. And probably a higher percentage of that in the local county jails. And the cost of this is enormous. The cost of dealing with these problems in prison is staggering. This is the cost of $345,000 a year of a mental health crisis bed in the California Department of Corrections. This is the amount of money that it costs to keep someone in a state hospital. The amount of money that it costs to keep the average inmate in the California Department of Corrections. $75,000 per inmate per year in the Department of Corrections. In a community-based mental hospital bed, $21,000. On parole with mental health treatment, a little less than $8,000 a year. So that's a figure that is roughly 44 times less than the amount of money that it takes to keep somebody in a mental health crisis bed in the Department of Corrections. So not only are there individual, social, and community costs, but there are profound economic costs to doing what we had once done. I know that there is going to be a lot of discussion here tonight about whether or not and how we balance the interest in the humane treatment of inmates against the very legitimate concerns of victims. But let me suggest to you that the one thing I know we owe victims is to ensure that there are fewer of them in the future. And that means that we need to approach the issues of crime control in the smartest, not necessarily the most punitive possible way. And as we have this discussion, reflect, if you will, on exactly how putting somebody in a bed like that, that's our jail in our community on a good day, for a longer period of time, makes it less likely that they're going to commit crime when they get out. Because in jail particularly, they all get out. And so I think we need to be reflecting on the history we've had, on the changes we've been through as a country and as a community, and on what we can do as a community to continue to minimize the number of people who are exposed to conditions like that, and in the interest of justice and crime control, approach things very differently. The person who's going to follow me knows this as well or better than anybody in this room, and so I'm happy to turn the floor over to our sheriff.
There's been a lot of system changes in the criminal justice system between prison realignment, Prop 47, Prop 57, Prop 64, data tracking, stop data tracking by the police, body-worn cameras. There's been a lot of stuff that has been thrown at us that has led to some really good reforms. And I think the justice system, particularly locally, is going really well. And we're one of the few counties that really embraced prison realignment when it hit in 2011 and had a plan, and we're on the same page with all the involved departments and actually implemented it very well. I'm concerned that with the rhetoric coming out of the Attorney General's office and the Capitol, that some of this reform may stop. We're talking about reigniting the drug war. We're talking, we've already seen increased immigration enforcement. And then this the so-called tough on crime atmosphere that's going on in Washington. And I think we really, as a community, we need to be smarter than that and strong enough to know what's good for this community and what works here.
Thank you, Sheriff. And now I'd like to welcome to the stage our next panel speakers, and that is going to be introduced by Nicole Cadle.
Good evening, everyone, and thank you for your interest and attendance this evening. My name is Nicole Cadle, and I'm the program coordinator of the Community Correction Partnership Speakers Bureau through Sobriety Works. The CCP Speakers Bureau program fosters leadership, civic engagement, and advocacy among formerly incarcerated men and women in Santa Cruz County. The participants will be answering candid questions about their involvement in the criminal justice system, as well as their personal experience with recent criminal justice reforms. I will now hand it off to our speakers to introduce themselves and let you know who they are and how they came to live in Santa Cruz County.
Hello, my name is Erin Miller, and I was raised here in Santa Cruz County. When I hit my teenage years in the early 90s, there was a lot going on in my life and in Santa Cruz. My mom had just recently divorced a very strict and abusive man and had become a struggling single mother of 4. This was at a time when Santa Cruz was still recovering from the quake of '89 and gang violence was out of control in my neighborhood. I found myself lost and looking for a way to fit in with life. That's when I found drugs. I didn't realize at the time that a little teenage rebellion would turn into a sinkhole of dependency that I would not find a way out of for many years to come.
Good evening, everyone. My name is Paul Martens. I was raised in and by our very own Santa Cruz Mountains here. I've heard before that it takes a community to raise a child, and in my case, this happened literally. Each of my parents struggled with alcoholism all throughout my life, and this caused us to often be without a home and barely getting by. More or less forced to fend for myself, I spent much of my teenage life living with whoever would open their door for me. At times this would work, but sometimes, most of the time, not so much. Having little to compare a situation to in my youth, whatever environment I found myself in simply became normalized. I grew up adapting to people, places, and things out of a need to survive, an act of desperation. I had little choice. Having grown up in constant need of charity and an outstretched hand, I developed some severe psychological disorders. From early on, I had anger issues, stints of suicidal depression, and felt constant fear of the day to come. 42 years old now, I wish I could say I have it all figured out, but I don't. I'm making a lot of progress, though, and I'm not overwhelmed by life like I have been before. I'm not here tonight because I'm proud of my convictions, my addictions, or my mental disorders. I don't want to be scrutinized or picked apart. I can do a fine job of that all on my own. I'm here to humanize addiction and to say thank you for giving me a chance instead of locking me away and pretending I don't exist. My experience is my greatest asset. It helps me to reach out to other addicts and connect where even professionals cannot. My experience makes me useful to others. Tonight you're hearing about justice reforms that have directly affected my life. I'm grateful and honored to be of service to you all this evening.
Our first question of the evening coming from the community is, what led you to your involvement in the criminal justice system, and were there any specific factors that brought you there?
Till I was about 11 years old, I lived in a house ran by fear. My mom, after recovering from what was ruled an accident, nearly lost her life and put her in a coma for about 2 weeks. Was finally able to get my brother, my sisters, and I away from our stepfather for good. Childhood trauma may not be a part of everyone's story, but it is a part of mine. Having found a sort of freedom in my life and taking advantage of the mountain of guilt that my mom carried on her shoulders, I found a way to do almost anything I wanted. And eventually I wanted to use drugs. I wanted to use drugs all the time. I used drugs to graduate from high school. All of the new friends I had made used drugs, and eventually I began selling drugs to make money for more drugs. That is the disgusting circle that my life had become, and it continued like that for about 2 decades. I eventually found myself in the county jail, looking at a few felonies and a 6-year sentence. Because I was sentenced as AB 109, I was offered a split sentence, half in custody and half out on probation. Because I made it a priority to attend programs in jail and take advantage of the recovery resources they offered, I was able to serve the last 3 months of my in-custody time on the Custody Alternatives program.
As I have already stated, I grew up very poor, and I'd watch my parents spend money on drugs and alcohol over things like food, shelter, and clothing. Basic necessities seemed like luxuries to me. I saw that most of my peers had stability and their needs met. So I always felt less than, inadequate, not enough. Even Santa Claus and the Easter Bunny validated my belief that the kids around me were far better than I. It was always very clear to me that I was separate, I was different, and I was on my own. And so I began to form a resentment toward life itself. But drugs changed all that for me. From the first time I introduced them to my body, I couldn't imagine wanting to feel any other way. Suddenly I felt connected, happy, and whole. I also felt duped. Weed was wonderful, so why was it illegal? Alcohol helped people laugh, sing, and dance. Why had it been so hard on my parents? Why was there a war on drugs anyway? I felt I had been lied to about weed and alcohol, and I began to wonder, what's up with these other drugs? By age 17, I was a heroin addict. For heroin, I would probably literally give an arm or a leg. No drug commanded my every motion, each thought process, like heroin did. I would have done anything to anyone for one more fix. And that's exactly what I did until I ended up in San Quentin State Prison at 22 years old. I spent 3 years of my life in prison, and it did nothing to rehabilitate me. All prison did was make life out here even harder to survive. In fact, of all the challenges I've ever faced, nothing comes close to the task of trying to navigate life out here after becoming institutionalized in there.
Because AB 109 made me eligible for the CAP program and was able to help with funding, I was able to go straight from jail to a Sobriety Works sober living environment. And being in a structured, sober environment, I was able to grow and move in a forward direction for the first time in years. Sobriety Works offered me housing, stability, and a ton of support by people who have been where I've been. Through county resources, I was able to access classes like Thinking for a Change through probation, the Speakers Bureau. I was also able to get help with finding employment and my license reinstated. Don't get me wrong, I had to work really hard in my recovery and program. I never thought that my life now was ever a possibility for someone like me. And I know I couldn't have done it or continue to be doing it without these resources. Here I am 2 years later. I am now the house manager of that same SLE. I am the assistant manager at my job, and I am able to help others work through the struggles of their addiction. I am also successfully still serving the remainder of my sentence. This county gave me a chance to change my life.
Well, for starters, I would not even be here now had it not been for Proposition 47 and AB 109 passing. And also for you, Rosie. No, I would still be locked away in prison somewhere, wondering if I would ever receive the opportunity and resources to prove my worth to society. Proposition 47 presented that opportunity for me by preventing a mandatory minimum prison sentence. AB 109 delivered resources to me through our probation department, Friends Outside, Encompass, and Sobriety Works. Additionally, AB 109 funded a residential treatment center for me, New Life, where I graduated early last year. I was given bus passes when I was on foot, helped with building a resume and finding a job, assisted in obtaining my driver's license and back, and given the chance to take part in our Speakers Bureau. Prop 47 prevented prison. AB 109 guided me toward a new way of life, a life I wouldn't trade for anything. Under our prior laws, I felt utter hopelessness. Today I am empowered and eager to help others along the path I just came. Furthermore, Prop 47 helped me in an obscure, intangible way. Instead of being forced into quitting drugs by the way of handcuffs, a judge, or a parole officer, I was given the dignity of reaching my own bottom. After a couple of quick releases for drug possessions, it hit me that I was going to die out there. An authentic desire to stop using was born within me. Anyone in recovery already knows that our foundation is the desire to stop using. Compliance only stalls drug use. Desire can seize it permanently. You can't force recovery. It never works. I'm grateful for Prop 47 because it thrust me into a situation of desperation. I became desperate for change, for freedom from active addiction, and that is the only way I've been able to overcome and recover from this disease. Be present and available in my daughter's life, hold down a job for over a year where I just moved into management, and most importantly, help others navigate similar struggles in their lives.
One of the biggest struggles I have is being able to communicate with society and being able to make that connection with people. I still feel very awkward and uncomfortable when I'm around people who have never been where I've been. This is something I have to work on every day. Managing a sober living environment through Sobriety Works, I see people every day who want to change, but aren't able to access services because they don't qualify for county funding or probation resources. Also, there isn't enough information for individuals seeking help. I personally wouldn't have had any clue how to get help if the CAP team and probation hadn't helped me along. I was one of the lucky ones. There's also still a huge stigma around the words felon, addict, or formerly incarcerated. But those are things we have each been labeled. As a community, we need to start looking at people's assets as opposed to continually pointing out their past mistakes.
Most of us are starting off with absolutely nothing. We need more treatment facilities, outpatient programs, and sober living environments. We need to make treatment immediately accessible to all who seek it out. Most addicts have no money or insurance to cover these costs. Transportation is a huge issue. Many of us don't even have a decent pair of shoes to get around with, let alone a bus pass or a bicycle. Maybe if you donated a bicycle to someone who's struggling, one less would get stolen. To me, personally, the barriers lie within the intent and marketing of these bills and propositions. Were they cleverly worded and packaged so as to deceive voters into passing reforms simply to reduce our prison population? Or are our people finally fed up with a war on drugs that only led to the proliferation of mass incarceration, disproportionately affecting men and women of color and segregating our society one more time? I have news for you. The war on drugs can't be won collectively, externally, as a whole, or even tangibly. Drugs will always be there, and so long as drugs are there, people will use them, and some will abuse them. Why a war on drugs when peace should be our aim? The opposite of addiction is connection, and until we show some unity and connect with each other, despite our differences, your war is as good as lost. A war on something intangible can only be won within. It can only be won individually, within ourselves, one by one and day by day. I haven't used a drug in nearly 2 years. Therefore, I am winning your war on drugs. Every day, I don't use. My personal barrier is your dialogue. Do you care about me becoming a valuable asset to this community? Or do you care about you not having to deal with me? I've paid for my crimes in ways I wouldn't even wish you'll ever know. Emotionally, physically, psychologically, my very soul seems suspended from time and space to right my wrongs. Now, can I please retreat from the front line of your war and find some peace?
So I'm asking you to just talk about it. Talk about how we, as a community, can give to those who really want it, the resources to change and save their own lives. Let's make this community of open doors and open hearts.
Don't write shitty stories about the world around you. Don't build cases against people that, in reality, need your empathy and compassion. That homeless man may have lost his house to the banks in 2008. That addict might struggle with mental disorders that make life feel impossible. They just need help, resources, and opportunities. Instead of marginalizing us or resenting us, try reaching out to us because we need you. I used to always be ashamed to accept a handout, but I wouldn't even be here had you not given me this hand up. Sheriff Jim Hart, thank you for a hand up. Mayor Cynthia Chase, thank you for giving me a hand up. Christy Clemens, thank you. Rosie Murillo, thank you. I wouldn't even be here right now if it wasn't for you. And finally, to the addict who still suffers, let us give you a hand up.